As a method for controlling anxiety and lowering arousal levels, breathing retraining helps you breathe more calmly and deeply. Most people understand that the way they breathe has an effect on their mood. The thought of taking a deep inhale to calm down, for instance, may come to mind when emotional distress arises. Another symptom of anxiety is rapid, shallow breathing. People frequently hyperventilate in times of extreme anxiety or distress because they mistakenly believe that they need more oxygen. However, overbreathing and rapid breathing are highly inefficient. Taking in more air than normal, also known as hyperventilation, triggers a response in the body that readies it for fight or flight. Hyperventilation is a known anxiety trigger. As a general rule, you do not need to breathe in as much oxygen as you let out unless you're preparing for a potentially life-threatening event. It is possible to use breathing retraining to clear the mind even when you are not experiencing anxiety. Bringing your attention to your breathing can help you become more present and thus better able to rein in intrusive thoughts. To top it all off, it has the added benefit of assisting the body in relaxing and releasing any accumulated tension and anxiety, which can ultimately impact your overall health. Breath control is a skill that may be developed with regular practice. Make time to work on your breathing techniques regularly, particularly when you are not in an anxious state. Breathing retraining is most effectively learned and practiced when the individual is calm and not experiencing significant anxiety. Once you've mastered the technique, you may apply it to other times when you are feeling worried, stressed, or uncomfortable, such as when you're in a large group of people or at the end of a busy day. As with any skill, the more you use it, the better you'll get. You should try to get in some practice time every day. There are many techniques you can use. However, in general, when you're feeling tense or overexcited and want to relax, try taking calmer, more relaxed breaths. The act of exhaling, not inhaling, is what is linked to feelings of calmness and the stress response regulation. A simple breathing technique, which we'll refer to as the relax method, will serve as the foundation of this guided meditation. This is a breathing technique best practiced for a time when you aren't super anxious or struggling to breathe and can focus on your breath as comfortably as possible. Rather than concentrating on taking slower, deeper breaths in, this technique will teach you to take regular breaths and to exhale them more slowly. When it gets more difficult to take deep breaths, particularly in the third trimester of pregnancy, this can be a lifesaver for the expectant mother. We won't be holding our breath or trying to force in extra oxygen. Instead, we'll work on our natural breath control to help regulate your pregnancy symptoms. To improve your breathing during and after pregnancy, this is just one of many techniques you can try. You should know that these recordings are not meant to serve as a substitute for professional medical advice or as a guarantee of any kind. You should always talk to your doctor or therapist first if you have any concerns about your health. To start, make sure you are in a comfortable position. If you are currently pregnant, it may help to stand or sit as tall and upright as you can. When you maintain an upright position, your lungs have a bit extra breathing space. If you are getting ready to sleep, Having a cushion or two under your upper back when you sleep can help gravity draw down your uterus and open your chest so you can breathe easier. The uterus can be kept away from the aorta, the body's main artery responsible for carrying oxygenated blood, by tilting the pelvis to the left while in this posture. For this, you can put a cushion, pillow, or pregnancy wedge underneath your bottom on the right side. Even a rolled up towel or small blanket can do the trick. For additional comfort, feel free to put a small pillow in between your knees. You may rest your arms and hands at your side, or place one or both hands gently on your upper abdomen where your diaphragm is. To open up your lungs, you may also lift your arms over your head and rest your hands underneath. A normal breath in is typically no longer than 2 or 3 seconds, while an exhale, like in the relax method, typically lasts around 4 seconds. This ensures that you are exhaling more oxygen than you are taking in. Once you are comfortable and ready to begin, simply breathe normally for a minute. Without overthinking it or forcing any changes, simply notice how your breath moves. Now, I invite you to take a normal breath in through your nose with your mouth closed, and exhale slowly through your nose, keeping your mouth closed. Upon exhaling, say the word relax in your head very slowly. For example, relax. As you do this, simply focus on the sensation of your breath entering and leaving your body. Let's give it a try together. Normal inhale, relax. Normal inhale, relax. Inhale, relax. Keep going, Mama. Remember, the point of this particular breathing exercise is not to force your breathing to change much, but rather to control your natural breath on the exhale to ensure you are not over-breathing or taking in more oxygen than you are letting out. Practice this exercise at least once a day while taking 10 to 15 breaths at each practice. This can greatly improve your overall oxygen levels and breathing capacity. You may even find it easier to take a deep breath when you feel you need it after engaging in this practice. Congratulations on completing this breathing technique. And remember, you are resilient and are doing a wonderful job trusting your body as you nurture the miracle inside you. Namaste, Mama.